Good morning, good afternoon, and good evening. Welcome to the 973rd day of continuous and uninterrupted Zoom session of IFPH. Let us start the day's proceedings with a silent prayer. Dr. Pradeep Kumar Gupta, please.
Yeah, thank you, Dr. Manoj. Today, we have a very sad news to inform to all of you. One of our faculty who used to come to our forum to educate our viewers internationally and locally, Dr. Mini Unikrishnan, who is a well-known, dedicated homeopath who particularly practice in gynecological and obstetrics problems, especially in infertility areas, died yesterday night with an accident. Another homeopathic organization awarded her with an award, and she went there to receive the award, and on the return, her car was hit by another car, and she died yesterday night. And this is a very sad news for us. It was a great loss for homeopathy in Kerala and internationally, though she focused her practice in Kerala, and we deeply regret her death and express our heartfelt condolences to the family, and we express our prayers for the eternal rest of her departed soul. And another small baby also died in the accident with her, that is none other than her grandchild. So we express the deepest condolences again and request you to keep 1 minute silence on behalf of IUPH and all those who gathered here to respect and honor her as a person, as a homeopathy doctor who contributed very greatly in homeopathy practice and especially in gynecological diseases. You can visit our YouTube channel to watch her immensely knowledgeable videos, mostly in our local language, Malayalam, and there are, I think, few in English also. So I request all to keep 1 minute silent prayer, 1 minute in silence to pray for the peace of her departed soul. Thank you. So,
Thank you, Dr. Pradeep Kumar Gupta.
Dr. Manoj, for continuing.
Really, it's a great loss. Anyway, let us start our proceedings. Today, our guest is Dr. Pradeep Kumar Gupta, MD, Homeopathy in Repertory, Materia Medica, and Organon of Medicine. He is a founder, chairman, and principal, Naminath Homeopathy Medical College Hospital and Research Center, Agra. Chairman, Naminath Ayurvedic Medical College Hospital and Research Center, Agra. The topic is Palliative Oncology, a very important topic, and homeopathy has got a tremendous role in giving some sort of solace to these unfortunate persons. So on behalf of IFPH, I welcome Dr. Gupta. You can have a platform for next 45 minutes. It's over to you, doctor. Please proceed.
The problem of cancer is rising very fast, and I'm very upset today. I seen 6 young men suffering from cancer. In the first time in my OPD, 6 young men came for treatment of cancer. So it is the biggest challenge now that the so-called modern medicine is not capable to deal with this deadly disease. But we can very easily treat this disease because cancer is nothing, it's a sora. And if wrongly we go on the line of the allopath that it is first grade, second grade, third grade, fourth grade, whatever the grade metastasis, this is all useless for us. We have, as a homeopath, we have to understand only one thing, that cancer is a psoric disorder, and the whole aim of the homeopathy physician is to find out the proper anti-psoric. Our biggest irony that our most of the so-called stalwarts give the disease on the name of the cancer. So the whole idea is that the cancer can be treated as a ordinary psoric manifestation, and according to the totality of symptom, from aconite to zincum metallicum are useful drug for the cancer. There is no specific drug for the cancer. Some people say this is organ medicine, some say this is that medicine. This, I don't buy these arguments. I have a large number of cancer patients always in my OPD and IPD, and I never differentiate them in any point of the way. So here I just want to share some glimpses, because 1 hour is very less to talk on this subject. This is the campus of Neminath where I do, and this is the Neminath Homeopathic Hospital. This is the first NABH hospital of India. Our father of medicine has said that natural forces are within us, are the true healer of the disease. So we have to find out the natural forces, which Hahnemann has said the vital force. So we have to just empower the vital force by correct anti-psoriatic remedy. That's it. Great Paracelsus has said no illness is that grave that would not have its cure in medicine. So every illness have its medicine. It's the duty of physician to find out that medicine. And that the path shown by the Hahnemann, the totality of the symptoms. This is from Kabir Das, that सब कहते हैं पोथी लिखी, मैं कहता हूँ आंखें दिखी. Means everyone is saying whatever written in the books. But what I say, whatever I have seen in the patients. So here I follow the Kabir Das. These are the images of patients taken from our OPD cases. So everyone knows that what is neoplasm and neuro, so I will not go on the detail. This malignant and benign. I just come to the topic. Breast cancer stages and the best treatment, only 26% people survive in the 5 years. And the other colorectal cancer, only 13%. So this is the result which, and the lung cancer, only 4% patients. So these are the results by the allopathic medicines. So the biggest challenge for us, what to do? The art of healing comes from the nature, not from the physician. Therefore, the physician must start from nature with an open mind. We all the physicians just forget what to do. We just go for the MRI, CT. We never understand what is the symptom of the patient. We just go for laboratory reports, this and that. So here I want to say everyone that don't go on that, just start from the nature, what the patient is saying, he is feeling. And the last word of Dr. Paracelsus that the doctor can have a stronger impact than any drug. If a physician who is treating the patient, if he himself is not sure that this is a patient of cancer, it will be all right or not, so patient will never be all right. So personality of the physician is more important than any drug.
Yes, sir. Now it's okay.
So here I am showing a case of carcinoma of lung. This is the patient, Uttam Singh, 62-year-old male. Address is Niwari, Tikamgarh, and the Madhya Pradesh. He came from the Madhya Pradesh. So this is a conversation in my OPD.
अच्छा और क्या समस्या है? उससे नहीं थी।
So it's a known case of carcinoma lung. The symptom narrated by the patient in the OPD: constant severe pain in chest with weakness. Ghabrat means restlessness since 10th December 2021. Severe breathing distress on walking. Paroxysm of cough with vial expectorant and watery discharge in shunt. Redness in eyes. Complaint begin with the breathing distress and heaviness in the chest. Ringing in the ear, or he feels the ears are blocked. Difficulty in breathing. Restlessness while bathing. And this restlessness increased as if fluid in the lung increased. So there was a lot of fluid in the lungs due to this carcinoma. Pleurisy lung, complete right lung and partial left lung. After consultation, shunt made in lung to drain the fluid. Must empty the bag at least twice during night only. So only in the night, approximately 2 liters fluid are coming from the lungs. Patient was already admitted in All India Institute of Medical Science, from where he reached to me. The past history was renal calculi and typhoid. A month ago, for which he took the allopathic treatment. The family history: father cardiac arrest, diabetes mellitus 2, 3 uncle, 1 carcinoma throat, 1 diabetes and 1 cardiac arrest. 1 brother cardiac arrest. So in the paternal side, lot of people have cardiac arrest, and in the maternal side also cardiac arrest, asthma, cardiac arrest, and 1 sister CA liver. So the cardiac problem and the carcinoma is running both the paternal and maternal side. By occupation, he is a driver, smoking addiction, 2 packets of BD per day, married in 1984, 1 male child and 3 female child, and diet mostly vegetarian, non-vegetarian occasionally. Appetite tolerable, thirst 3-4 liters a day, tongue white coated, salivation present, desire sour, apple and curd, stool 2 times a day, urine satisfactory, perspiration more especially on thighs, chest, thermal reaction hot, sleep right side, uncover the face. Mental journals, anger expressed, desire for company, easily involved with the people. He was not on regular job, depends on wife for expenses of family and its bread and butter, as she is a government job. Married his second daughter in 2015, but son-in-law is alcoholic. This is the stress. So now you make your own totality. I had given all the symptoms and just an exercise in your mind what to give. Prescription. Carcinoma lung, pleurisy, 2-liter fluid per day, admitted in various allopathic hospitals, already had a shunt in the lung and came for the treatment in a homeopathic hospital. And the OPD conversation we all have seen. My prescription was sulfur LM1. One globule mixed in 100 ml of water, 5 ml solution mixed in a cup of water. A small quantity of from this to be taken. And I repeated medicine very frequently. Those who follow me, they know my dose is 5-minute interval, 4 doses. This is his report. Malignant cells in cytology, pleural fluid. This is the histopathology final report. Pleural fluid, cell block, metastatic adenocarcinoma, primary pulmonary origin. This is the report from Tata Memorial Center. He also visited there. So he visited many hospitals of allopathy, but no result at all. So this is the video on the very first day in my IPD. Soreness of throat is reduced, but the fluid discharge is persisting. Restlessness is reduced and breathlessness is reduced. So now I sulfur LM2 1 hourly. Fluid is still persist, but cough reduced. The other ailments are reducing, not the fluid. So I increase the potency LM3 2 hourly. So listen the conversation. What patient and attendant is saying, that this is the day 3. There is no fluid is coming now. no cough and no fluid. When the so many allopathic hospitals fail to deliver the result by chemotherapy, by radiotherapy, and your sulfur stop the fluid only in the day 3s, also the cough, also the breathlessness. See the happiness of the patient face and on the attendant also. He is the son. Fluid from lung didn't increase a bit since is admitted, sleep good, no cough, paroxysmal cough, no sore throat, no coraza. Son is very happy, sulfur LM 3 hourly. Now the follow-up after 15 days. Listen what the patient is saying. So he was discharged on day 3 and I didn't take out his tube as he fearing that the pleural fluid may come again. But whenever he reached his hometown, he gone to the surgeon and he take out the tube because there was no fluid after 7 days. So now he is not carrying that bag and the tube, and he is confirming that he is absolutely all right. So this is the power of correct simillimum, and if you understand the case well, the symptom which I have mentioned, fluid discharge not stopped from the next day. So lung was removed, cough sometimes at night, appetite good, breathlessness reduced markedly only on exertion. Taking bath easily now, no restlessness, no ringing in the ear, no coryza. Since then, till now, he is completely fine. So it was almost 2 years. We are having actively his follow-ups, and he is absolutely all right. And the sulfur LM3 is still being given 2 hourly. So this was the first case. Now I am going to show another case. This is a child with renal
Sir,
carcinoma.
why sulfur given, sir?
This is not the question answer session. Just wait.
So it is accidentally happened, sir. No question.
Okay, no problem. I will give an answer of each and every question. I love questions.
Yes.
So those who
yes,
are
sir.
connected with
Yes,
me,
sir.
be sure I will not leave the platform till every query has resolved.
Yes, sir. Up to 9 o'clock, 8:45, you can have the session, then 15 minutes for questions, sir. Yes, sir.
No, I can take all the question.
Yes, sir. After 9 o'clock, we have the Malayalam session. Okay, sir. Thank you.
Okay, no issue.
Yes.
So, case of renal carcinoma. It is a child named as Farman. 75 age jaldi uski. 15 को 45 को बाद में कर दिया.
कब से हो रही है बेटा ये परेशानी? और क्या परेशानी हो रही है आपको?
पैरों में हो रही है जलन सी वगैरह और कब और पीठ में पीछे तो दर्द
इसके लिए कोई किसी डॉक्टर को दिखाया आपने?
नहीं, सलमान डॉक्टर दिखाया था।
उन्होंने क्या बताया? क्या बताया?
वो पलेटिव एंटी कर थी, बोलने के हम बता, बोलने के साथ इन्फेक्शन लग गया था, बच्ची हो गई, दवाई जरूर।
डॉक्टर ने क्या बताया? क्या परेशानी से? चलो फोटो में कैंसर की बात।
Pain in right side of the abdomen since 2.5 months. Aggravation, motion, walk. Amelioration, rest, massage. Severe burning in palms and soles. Aggravation, night. Amelioration, cold air. Blood in urine since 1 month. Aggravation, night during urination. Amelioration, rubbing the lower abdomen. Severe weakness since 5 months. Hard nodular swelling in abdomen covering right half of the abdomen. Below umbilicus since 3 months. Pain in this nodular swelling on abdomen, aggravation, lying on affected parts, lying on affected side, amelioration, rest and massage. Past history, typhoid 5 years ago, history of dog bite at the age of 4. He is 15-year-old child. This is a family history. Father, brain hemorrhage, died. Grandfather died. Grandmother, diabetes mellitus. Maternal side, mother, hematoma. Grandfather died. Grandmother died. Nothing more. Non-vegetarian and a student. Physical generals, appetite good, tolerable. Thirst 2 to 3 liters per day. Desire tea. Stool satisfactory. Urine uncontrollable. Sleep disturbed. Thermal, ambithermal. Mental general, history of grief. Father expired 8 months ago due to brain hemorrhage, and after that mother suffering from hematoma. Desire for company, sudden change of mood, in anger bites other. These are the investigations. This is the investigation already has done. We go only on the conclusion. Findings are suggested of mitotic pathology. Cytology, aspiration from right leg fascia, renal mass. Cytological feature are suggestive of malignant epithelial neoplasm, possibly renal cell carcinoma. So it's a case of renal cell carcinoma. Montreux were negative to confirm that it may be diabetic lump, but before that, so it is confirmedly by the cytology that it is a renal cell carcinoma. His hemoglobin is 7.6 and the neutrophils are 72%. So what to prescribe now? Anna, do you have any idea?
Yeah.
So just understand what to prescribe, and I am going to surprise you what I have given.
Is the biting important?
Is the
The biting. Where he bites people when he's angry?
yes. Correct. You got the right point. So any idea of the medicine? No? Belladonna LM1. I never see cancer. I say who is sick. I see only that. So come here. Desire for company. Sudden change of mood. In anger bites others. So angel when well and demon when sick. Also come to the interview first. Look, this is a child. He's having renal cell carcinoma and very painful. And just watch his conversation. So I got him admitted, and thereafter this medicine was prescribed. And see,
तो सही
friends, it's a case of renal carcinoma. As a small boy, and it is a case of renal carcinoma, so the heart goes. And it was कितना दर्द था बेटा पहले से?
पहले तो बहुत था
कम हो गया। अच्छा, एक दिन में कितना दर्द कम हो गया ये बता दे।
थोड़ा
थोड़ा बचा है या थोड़ा ठीक हुआ है?
थोड़ा ठीक है।
ओके, ठीक है। So much big disease and so much pain, and the boy is laughing. So everybody should guess what is the medicine. The medicine has been prescribed by me. That is belladonna. And the misery of the teaching of the homeopathy that people understand the belladonna is the acute drug. Actually, there is no acute or chronic. Drug is drug. Totality is totality. So I am given belladonna for renal carcinoma, and the child is much better. Here's the report. कॉपी लगा ली बस में ये भी केस ऐसा है जो so another symptom emerges after belladonna, laughing while talking. He is confirming the pain is reduced, but not much reduced, and in so much pain he is laughing. So this is the correct understanding of the remedy at the bedside. Pain in abdomen is slight better only in day 1, less than 24 hours. Aggravation night, pain is better. Patient is very happy and laughing face. Nodular swelling on abdomen is also better. So I didn't change the potency or the repetition. Belladonna LM1 1 hourly. Now the day 2, second day. Listen what he is saying. So only day 2, the tumor size also reduced. And the mother also confirming, I also examined, and the patient himself saying his node is reduced. Node is slightly soft also, not so hard as it was yesterday. Size of node reduced, pain in abdomen much better. Nodular swelling of abdomen is slight better. So same medicine and same potency and same repetition. Day 3, look the happiness on the face. So this is homeopathy. What homeopathy can do, nothing can be do. No chemotherapy, no radiotherapy, no surgery can produce this kind of result. So homeopath has to understand the power of their prescription, power of their correct remedy. And I enjoy this happiness every day in several cases. Look, happiness. So the child confirming that pain is very slight remaining and the nodes is also reduced much. This is only day 3. Cough is better, pain abdomen better, nodular size of reduced, no new complaint. Belladonna LM2 1 hourly. Look the happiness, day 4. So this is the changes of the body language, changes of personality. This kind of changes only homeopathy can do.
पूरी तरह से दर्द बंद है? कब से बंद हो गया है? कल से पूरी तरह दर्द बंद है, बिल्कुल नहीं हुआ। हल्की खांसी। अच्छा, जो गांठ सी पेट में वो कैसी है? कुछ कम हुई है? लेट जाओ, लेट दिखाओ। हाँ, टाइट पर कम हुआ है। हाँ, हो जाएगा ठीक। ठीक, सो
So it is short time, only day 4, no pain, size is reduced, tumor is soft, no tenderness, and people think belladonna is a acute remedy. So I purposefully showing this case that remedy is remedy, neither acute nor chronic, neither short acting nor deep acting. You just try to find out remedy, don't go on the nonsense. Pain in abdomen completely better in day 4. Size of node reduced further. Cough is better. Tightness of abdomen is better. Belladonna LM3 1 hourly. Day 5. Only day 5 I have discharged him. So I show you 2 cases here. One case came from many hospitals. I discharged him on day 3 only. And after a week, his tube was out, no discharge. And in this case, only 5 days, no pain, no complaint, and size is reduced remarkably.
Yes, sir. Wonderful case.
Listen what he is saying.
Yes.
Still it is visible. The tumor is still visible, but much reduced than before. All complaints are better. Pain in abdomen, no. Tightness, better. Cough, better. No new complaint. Belladonna LM3, repetition 1 hourly. And I discharge the child. And he is absolutely all right.
Yes, sir. Of course. Our participant is also absolutely all right now. Very happy to hear him. And let me inform you that on the coming July 29th and 30th, Dr. Pradeep Gupta will be at Kerala for a workshop or attending. So I am announcing that those who would like to participate must participate and listen from this great legend of homeopathy, the wonderful art of medicine. So time for discussion. Those who would like to participate can go to the participant list and raise your hand. And of course, IFPH is of celebrating its 1,000-day continuous and uninterrupted Zoom session. We are doing this work for the last 7 days uninterrupted, sir. That is the most important thing. So we are conducting now it has extended to 3 sessions, from 7 to 8 the Hindi session, 8 to 9 the English session, that is international, and 9 to 10 the local language Malayalam session. So that's regarding the IFPH programs. Now it's time for discussion. A lot of persons raise the hand, and the first one is Oppo. Who is that? Oppo F919. If you rename yourself, it's always better. Oppo, please unmute. Yeah, please. Unfortunately, it's not. Is there now? Is Sridhar Kumar, please. Sridhar Kumar, please unmute, sir. Please unmute.
Oh, okay.
Yeah.
Whether it is audible.
Yes, sir.
Professor Dr. Pradeep Kumar Gupta, your section was excellent. Your examples with wonderful. What we feel that some of the medicines are acute, but it is acting. Even I too got very good result in such type of the medicines. We feel it is acute, but that even this acute can also be so many times. If it is correctly selected, definitely it will act. Thank you very much. Come again. You are also in our Hindi section also coming. So please coming in Hindi section also more. You are a well-versed person. Very good, excellent presentation. Thank you very much.
Yes,
Thank
definitely.
you. Yes.
Yes, sir. We heard, we realized, recognized that it's a genius. Yes, Ahmad Hassan, sir, please. The Ahmad Hassan, sir, from Saudi Arabia, please, sir. Yes.
गुड इवनिंग सर डॉक्टर गुप्ता सर जी मैं सेंट्रल जालमा इंस्टीट्यूट लेप्रोसी ताजगंज आगरा में 1976 में था उस टाइम तो शायद ये मेडिकल कॉलेज नहीं था लेकिन डॉक्टर पारेख बट डॉक्टर
2010
हाँ बट डॉक्टर पारेख सर से मेरा ऑलवेज कांटेक्ट रहता था थैंक यू वेरी मच सर गॉड ब्लेस यू एंड सी यू इन आगरा इंशाल्लाह
Thank you.
Thank you, sir.
Thank you.
Yes. Now another legend, Dr. Mridul Sahani. Sir, please. Welcome, sir.
Okay. So thank you, Manoj.
Yes, sir.
Yeah, thank you, Manoj. I was listening and because I know Dr. Pradeep since long. I had visited his center some time back, and I have seen the things how wonderfully he handled with each patient. I stayed at his hospital for more than half a day, and there I witnessed. I can say that I am the witness for this activity that what he is doing. So really, his work is very commendable. And one thing is very important when you visit this hospital at Neminath in Agra, you can find it what magnificent hospital he has prepared. This is very important for us to see that. And everything is well equipped, everything, all taste, everything. And beside this, he is also running the PG colleges and the homeopathic colleges. And the students, I have talked with the students. I stayed there for the whole day. And I found, I think about 2 or 3 times I visited this. And whenever I get an opportunity to visit Agra, I feel like meeting Dr. Pradeep. Well done, Pradeep ji, for your very nice presentations. And as Dr. Sridhar has requested to come you again in the Hindi session also. So please do come. I have also requested you earlier also to come for all the Hindi sessions also. So thank you, Pradeep ji, for your very nice presentations.
Yes, thank you very much, sir. You are so generous and you are a teacher. Thank you. I have a high regard for you, sir.
Yes, sir. That is Dr. Mridul Kumar Sahani, a wonderful person. And of course, we know that at present, Agra is known because of Taj Mahal and the coming days, it will not because of you. I hope so, sir. Pradeep Kumar.
Thank you.
Yes. Now, Dr. Hariharan, sir, please. Another legend, Dr. Hariharan, sir, senior most person.
Hello,
Sir, please.
hello, Dr. Gupta ji. So wonderful
Yes.
case. Really
Thank you.
really congratulating. See, one of my doubt is that you are giving LM potency only up to 4, or will you give in higher doses to stop the medicine?
Sometimes I do that. Sometimes I do that.
How you raising the potency, sir? According to recovering the patient, you are increasing the potency, or by observing the pathology, you are increasing the potency. Let me know.
Sir, I mostly don't go on pathology. I start with LM1 as a rule, and till the patient feel better, I continue the same remedy in the same repetition. And whenever I found that the patient is not going further better, the pace of the betterment is reduced, so I increase the potency. And once I found out that the potency is better and everything better, then I reduce the repetition. And sometimes I increase the repetition. It is an art, and it is well documented in the aphorism 247, 248, 249 and their footnote. So I don't do anything new, nothing is mine. Whatever the written in the organon 6th edition, in the aphorism 246, 247, 248, 249, 250, 251, and their footnotes, and 272. I follow that only.
Yes.
Okay.
Yes,
Thank you,
sir.
sir.
The
Thank you, sir.
unprejudiced observer. You are the real disciples of Hahnemann, sir.
Okay.
Now the Oppo F19. Please proceed. Who is that? It's always better to rename yourself so that we can identify you. Okay. Now Dr. Rujira. Yes. Rujigar. Yes, Dr. Ruji. Please.
हेलो सर, डॉक्टर
Yes,
प्रदीप
hello.
गुप्ता सर। मैं मेरे लिए आपका एक वीडियो मैं आपको स्ट्रांगली फॉलो करती हूँ, और आपका एक वीडियो, आपकी एक वर्डिंग,
Dr.
मतलब
Ruji,
रियली
this is
मेरे लिए
English session. Kindly
बहुत।
put in English. Dr. Ruji, kindly put in English. This is English session, please.
ओहो, सॉरी, ओके।
Yes. Okay, there we have international persons are also. Who is this A2, madam? Please give an introduction. I think you're first time in the platform. Am I right? Yes, please.
Hello. Well, I had a few questions. I just wanted to clarify something that I know Dr. Pradeep's mentioned before. Hahnemann has the chronic diseases remedies, and then he has his non-antisoric remedies. So does Dr. Pradeep set aside that splitting that Hahnemann did of the remedies and just go in with a non-antisoric remedy like belladonna as easily as with an antisoric remedy when it's needed? Yeah, Dr. Pradeep's nodding.
Thank you, Anna. Thank you for raising a very well question. What he write in edition first, he changed in edition 2. What he write in edition 2, some portion he changed in edition 3.
Okay.
So whatever he write in edition 4 changes in 5.
Okay.
So the dry dose up to the edition 4. Now in the 5 and 6 he mentioned the water dose.
Okay.
And in the 6th edition he mentioned the LM potency. So few medicines like gelsemium, he first put on them in antisoric, meserium also antisoric, then taken out. So it was his experiment, and I believe that his experiment was nice and everything fine. But what I observed in my IPD, because I am running indoor patient department since 2007 in my hospital.
Yeah.
And I have a large number of admitted patients. So my understanding that I have cured serious pathology by Gelsemium.
Right.
I have cured so many pathology by Ignitia.
Right.
I have cured so many serious pathology by Hyoscyamus. So in my opinion, though he didn't mention and take out some remedies, they are not antisoric, but might he survive few more days, more years, and with the experimenting the things, he might include them in antisorics. So Hahnemann, by such a genius, he never say that you don't experiment. If your experiment is on the right track, you can experiment on that. So this is my suggestion and this is my research that I found these remedies are not acute. They are very helpful in the very serious cases like Aconite.
Okay.
In my entire life, I never prescribe Aconite on acute condition. I prescribe Aconite always in the chronic condition and I found the result. So my humble submission to the fraternity, whatever written by the Hahnemann is absolutely all right, but he never stop you researching. So do the research. Thank you.
Repeat the experience. That was the suggestion. It's nice. Madam, could you please give an introduction? I think you are the first time in the platform. Please.
I introduce her. She is Anna.
No. Pardon?
She is Anna. She is from the Scotland. She is my follower. She is joined because I was joining here.
Yes.
And she is one of them. She listen my each and every video. And like Dr. Ruchikar, she is also my follower. And she each and every video, there are a lot of my followers. They follow me on the Facebook, Instagram, and they believe what I am saying is correct because I am not an individual. I am an institute.
Yes.
I am a postgraduate institute.
Okay,
and all the work is not done by me. This all the work done by my students. I am their only mentor. So whatever I present, whatever I say, that meaning that I am a teacher, I am a professor of Materia Medica, and I am principal also. So I have to say always truth because the work is not carried out by me. The work is carried out by my interns, my resident doctors. Those are the first year MD. So, we are the institute. So we are always available to the scrutiny of each and everyone. In this platform, I say whatever the people are saying, seeing this, they can come at any time. And they are also eligible to search the original records of the patient because we have always consent from the patient for the research purpose. So everyone can see the file.
Yes, sir. Dr. Ganesh, please. Yes. Yeah.
Good evening.
Good evening, sir.
Good evening, Pradeep Gupta, sir. It's really an amazing presentation, but nobody could believe that such things happen with homeopathy. It is the right time to show the world that homeopathy can do this kind of wonders with this single remedy. Particularly, you have shown how beautifully the minimum dose works in a highly pathological condition. But nobody could believe in such things because that is even still, the Wikipedia says that homeopathy is pseudoscience. But frankly, we can show the world with these kind of cases that homeopathy is the most modern medicine which has the power to cure the incurable cases. And you have shown how beautifully the single medicine, in particular the belladonna, works in a cancerous case, and that too in LM potencies. Sir, my question to you is that whether you sir, use any no source here, or whether usually people are prejudiced in the way that these remedies, as you rightly point out, that the belladonna is an acute remedy, Gelsemium is an acute remedy, Aconite is an acute remedy. But frankly, no homeopathic medicine is an acute remedy.
Sir.
Yes, this is a question, sir.
Yes, sir. One more person is also waiting. Please, sir. Please.
So,
yes, sir.
Just I read a aphorism. The unprejudiced observer Aphorism 6. Well aware of futility of transcendental speculations.
Which receives no confirmation from experience or experiments, sir. Okay, sir.
So the unprejudiced observer take notes of, well aware of futility of transcendental speculations, which can receive no confirmation from the experience. So
Yes.
my suggestion to everyone, whatever is written, please go and experience it. If experience is contrary, then don't follow it.
Yes,
So,
sir. That's a good suggestion. Yes, sir.
So
No,
I
doctor.
always say that homeopathy is a observational science. Your observation may be different from my observation, but if you think correct, true perspective, then you can find out your remedy. So I use nosode. Definitely I use carcinosin too much. I use medurinum. I use syphilinum. I have more than 10,000 cases of syphilinum. At this time, I have more than 1,000 cases under syphilinum, more than 2,000 cases under medurinum, and maybe 500 cases under carcinosin. So
Yes,
I use
sir. Yes, sir.
nosodes, and
Okay.
more than 500 cases under osteoarthronosodes. So I use them, but what I see what the patient is saying, his words, his body language, his facial expression, and I try to understand the remedy from the words of the patient.
Yes, yes, sir. Now,
Thank you, sir. Thank you very much,
time
sir.
limitations. Dr. Manmohan Supla, in 1 minute. You have to wind up the session at 9 o'clock. Yes, please. Yeah.
Hello, sir. Good evening, sir. Sir, ko pranam charas par sir. Sir, I visit in Ahmedabad Medical College, Homeopathy Medical College in April. Clinical training 5 days. All questions are clear. And sir, practice is organ of medicine. Master Haniman says every each confirmatory prescribing of single remedy. And I learn prescribing of homeopathy medicine in single remedy. And hope is on in your practice, apni practice apply and we're more results. And I bless you, Dr. Pradeep Kumar, sir. Every video, every case, I understand very well. And
Okay.
I requested more seminar in the sir and in future organized.
Yes.
And
Now it's time
everyone,
everyone
requested.
Yes, yes, please conclude now. Yes, sorry, you have to finish in time. Now I invite Dr. Sevgi from Turkey to express a lot of thanks. Dr. Sevgi. Yes, please.
Good evening. Thank you so much. Very wonderful session. I want to ask Dr. Pradeep, and you use LM potency in the beginning of the case. I understood you take the acute cases like your cancer patients and were unprejudiced and like all the visual symptoms and changes take and give the medicine. But I want to learn 2 years later or more than follow up. What did you do? And what is your program? For example, sometimes constitutional, sometimes if you need nosode and other remedy, and every time give LM potence or later C potence use it. Thank you so much.
Yes.
I grasp a small thing because so once the patient is better by the LM potency, I never use the centesimal. If the LM potency stop working, then I use centesimal or decimal, whatever it is. I also practice in decimal. I also practice in centesimal. I hardly change the remedy if the symptoms are same. So I change the scale. So this is the one. And number two, I never use dry doses. I use only water potencies. I use single globule number 10 mixed in 100 ml of water. From that, I give 5 ml of the medicine. Further diluting in cup of water, from which only few teaspoonful doses. So my methodology is totally depending on the this edition 6, whatever written, I am doing that, and I welcome to the all the doctors all over the world. They can come and stay with me, and they can see themselves what we do in our hospital.
Okay, sir. Okay, thank you very much for your participation. With that was the end of today's English session. Hope you to meet the same time tomorrow. Till then, goodbye, and over Dr. Sanesh for continuation program in Malayalam. Thank you.
Thank you. Thank you very much.
Thank you, Dr.